Hey guys, how you doing? My name's Gus, and today we're going to look at really cost-effective solutions for replacing missing teeth. Okay, so if you've seen my other videos, I took a whole bunch of videos on things like all-on-4 and stuff like that, which tends to be a more premium top-end treatment. Okay, now the downside of the premium top-end treatments is that they do cost a lot of money. Okay, and typically most places in the UK will charge about £15,000, somewhere between £15,000 and £20,000 per arch. Okay, so if you've got all your teeth missing, that's a big amount of money. Now, it's not the only option, okay? There are plenty of options available. So if we run through them quickly, if you've got no teeth or your teeth are what we call terminal, where we just can't keep them, you can either have them all removed and do nothing. Now, absolutely nobody in the world wants this option. But a step up from that is that you could have removable dentures. Now, removable dentures tend to get a bad name because typically in the UK, they're done under the NHS, and the lab work is, everything under the NHS is done to really reduce cost to the end user. And that ultimately does reduce quality. Now, a really well-made set of full dentures can actually not be bad at all. They will look just as good as any all-on-4. And the top one especially, the neat thing is, because it covers the roof of your mouth, you're able to get a suction there. So sometimes, it's quite difficult to pull these top dentures out because the suction hold is so good on them. They tend to be the more cost-effective solution. So typically, if you're paying privately, a few £1,000s is about right there. Now, then if we're moving on from just removable dentures, we can stabilize them with any number of implants, 2-4 implants, and you can have clip-in teeth. The advantage of this is you tend to have less of a footprint, so that bit which covers the roof of your mouth is no longer covering the roof of your mouth. And then we can move on to what we call fixed prosthetics, so fixed set of teeth on implants. And this is when we're starting to talk about all-on-4s and stuff like that. Now, let's not talk about all-on-4s. I've got a whole ton of videos about that. Let's look at if you're in a situation where you've got no good teeth or everything needs to come out, and maybe you've got removable partial dentures and they are terrible, but you can't justify the cost of spending £30,000 on your teeth. Then there is a study, it's called the McGill Consensus. And you can Google it and you can find some information about this. And essentially they looked at the situation where more and more people have no teeth or no good teeth. So what is a good solution for them? What would be the gold standard? And not gold standard in terms of infinite money to spend on your teeth, but a realistic money to spend on their oral health. And they found that the top removable denture was actually pretty good. Okay, for the reasons I've just explained. It's the suction is really great, the aesthetics can be made to look really good. But the problem is with the lower set of teeth, the footprint that these dentures have to sit on bone is much less. That means that they're much less stable, they'll rock around a lot more, and we also have the muscles of the tongue and the cheek, which every time you move your tongue to speak, they're going to dislodge this lower denture. Now, some people get on quite well and they learn to accommodate with a loose lower denture, but what we have found is that it does change what people eat, and people will have a preference to choose softer foods or foods that they're able to eat rather than the more nutritious stuff which they might want to eat. So let's assume that a lower denture is kind of substandard, okay, because it's affecting the patient's life in a way that it could lead to possible malnutrition or just a change in diet, where we can avoid this change in diet by doing something else. So our next entry-level options, what I normally speak about, is mini implants. And mini implants are great. They're pretty cost effective. And typically we have 4 mini implants. But there is another option if we're really trying to reduce costs, okay? And this is something you don't need to go and see a specialist for or anything like that. Most dental practices will do some level of implant treatment, and this is a really basic level implant treatment that the vast majority of dental clinics will be able to provide. And that is just having 2 implants at the bottom, at the front. Now, we can do this in such a way that you can take out all the bad teeth and put the implants in straight away. I wouldn't connect the teeth to the implants on the same day, so there will be a healing period where you'll have a loose denture, a loose lower denture. But once the implants have healed, you can have connectors placed on the implants, and if you've already got a denture, you can have that denture retrofitted onto these 2 implants. Okay, and we're talking about standard implants, not mini implants or anything like that. Most people have enough bone down here. In fact, out of all the whole jaw, this bit of bone right at the front here, between where your canines or premolars used to be, that is the best quality bone of the whole mouth. The number of complications you have down here are minimal because the bone quality is typically so good. And that's why I said that almost any dentist who does implants is able to provide this solution. Once the implants are integrated, as I say, you can have your denture fitted into those implants, or you can have a completely fresh denture made. And the quality of the denture, I believe it does matter, because these kind of teeth are supported both on gums and on implants. And if you look at my other video where I talk about whether you should have gums or not on your all-on-4, if you skip right to the end, I talk about the 2 type of removable prosthetics. And this, if you've got what we call locators or clip-in teeth is how they're commonly referred to. If you have these, then they do sit on the gum, and your biting pressure is taken by your gum as well as the implants. So that bit which sits over your gum has to be made well, and the fit does need to be good as well. Any dentist will know how to make a half-decent lower denture, so you should be able to get this kind of option readily. Cost-wise, all we're talking about is the cost of 2 implants in addition to the cost of the denture, and most people already have a denture. And often, especially with finance options and splitting the payments and things like that, this does make it, I'm not going to say it's affordable for everyone because everyone's situation is different, but it's a much more cost-effective solution than the £15,000 options that we're talking about when we start looking at full arch fixed set of teeth. But it's not all about cost. We have to think about the cost benefit. And the benefit here is that you've got these teeth which used to move around and are almost unusable for some people, and they're suddenly stabilized dramatically, and you're able to eat a lot more food. You stop choosing what you can eat because of your teeth, and you start choosing foods which you would like to eat, and typically they're more nutritious. So there are additional health benefits, not to mention the psychological benefits of having teeth which you're confident aren't going to move around when you talk and put you into possible embarrassing situations because of that. Okay, so I know on this channel quite a lot, and to all of my patients, I hardly ever recommend this option, and that's because the way our practice is, people tend to find us for the more robust, more top-end solutions. But that doesn't mean that that's the only solution there. There are other solutions which will still last a long time, and it's proven in the dental literature that this is a dramatic improvement. The way they figured this out was they did what we call quality of life questionnaires for people who've got just removable dentures, and then they had the implants put in, and they do the questionnaires before and after, and they've got a very analytical way of figuring out, is this a better solution than not having any dentures? So the long and short of it is that having 2 implants on a denture is typically the gold standard for the most cost-effective way of restoring a full set of lower teeth. So let me just read you the conclusion of the McGill Consensus. The evidence currently available suggests that the restoration of the edentulous mandible, So that's a posh way of saying the bottom teeth. So with a conventional denture, i.e. no dental implants, is no longer the most appropriate first choice prosthodontic treatment. There is now overwhelming evidence that 2-implant overdenture should become the first choice of treatment for the edentulous mandible. Okay, so what that's essentially saying is what this video is all about. If you can stretch to 2 implants and a full set, just a denture, it's going to dramatically improve your quality of life compared to either having no teeth at all or having a loose lower denture. Okay, so I hope you found this video useful. If you've got questions and comments, you can always leave them below. If you want to see other videos that I've done and playlists, I'm sure it will suggest on the side here somewhere. Okay, guys, until next time, take care.